Good afternoon to everybody, to the moderator, to the panels, and people joining us remotely. For the panel two, we have Dr. Kamatenzi, who is the Assistant Professor and Deputy Dean Academic Affairs with the Kisargebo University of Medical Sciences here in Bhutan. Dr. has completed his MBBS from Sri Lanka and has several publications to his name, and we are very happy to have Dr. moderate this session on volunteerism and public health. And without taking too much time, may I now request Dr. Karma to take over the floor. Thank you so much, Doctor.
Las Dashu, thank you. Good afternoon to everyone once more, and welcome to this the second session of the day of this conference. The first one was, I must say, very enriching, very extremely relevant, and at the same time very interactive. And the second session is on, as evident from the title, volunteerism and public health. So I leave my introduction, as I think Dashu Sanghi was very generous enough to introduce me. And just to move on, I must commend the organizers for coming up with a very perfectly matching sort of a couple title, the volunteerism and public health. And that really fits so much into the current context of COVID-19 situation. And we must understand, and we must understand that volunteerism and our robust public health are very critical, vital for the development of a very resilient society. And again, that is one of the theme of the conference. And for that, we also translate into a nation with vibrant democracy, again, being the first part of the title or the theme of the conference. If you really look at here in Bhutan, His Majesty the King is epitome of the role model, leadership, compassion, humbleness, selflessness, teamwork, and empathy. And if you really look very closely, volunteerism is also associated with these qualities and attributes. In the form of our compassionate monarchs, we have seen, we have lived, and what is true volunteerism mean? What does it really mean? And for this, every Bhutanese must pay our deepest respect and prayers to our kings for their deepest love and affection demonstrated over a century now. And public health pandemic is all about public health urgency. And volunteers, again, volunteers from all quarters of community within Bhutan played a very big and a major role in the management of these urgencies so far. And it stands true even in the global context, not only Bhutan. As per the report from Ministry of Finance, Bhutan has spent 2.9 million nultrums in last 9 months on handling of COVID pandemic. That clearly shows the leadership, the clear strategy in handling the COVID-19 pandemic scenario. If you really listen to the various reports from WHO and other health agencies, due to pandemic 19, in many countries, the essential health services were disrupted for various reasons, for financial reason, for political reason, and very other reasons. But in Bhutan, we have successfully maintained that continuity in essential services, again, giving a clear indication on the leadership. But we also have to be very mindful that, yes, leadership does matter, but so does the concept of volunteerism. Again, keeping in with, aligning with the theme of today's this session. And we also must appreciate that the government might possibly would have ended up spending much more than what is reflected as 2.9 billion had it not been for the true sense of volunteerism exhibited by the people of all walk of life, as also highlighted in the royal address at Punakha on 17 December. So with this background in about volunteerism and public health, now let us listen to the three speakers who bring with them various perspectives, various experiences on both volunteerism and public health urgencies from all the way from Samtsi, Gilfu, and Mungar in the Far East. So let me introduce the first speaker, First speaker for this session is Mr. Sherab Doji. Mr. Sherab is a reporter with Bhutan Broadcasting Service and currently stationed at Samti. And since his graduation from Sherab's College in 2014, he has been working at Bhutan Center for Media and Democracy before joining BBS in 2017. And of course, he himself is a Desu, and many of us who have seen and been following BBS for last 9 months, we have seen, I think he has generated quite a number of good reports from the field. And then the second speaker is Dr. Chimi. Dr. Chimi has a Doctor of Medicine in Ophthalmology from Faculty of Postgraduate Medicine under Gesagalpa University of Medical Sciences, and MBBS from University of Colombo in Sri Lanka. And she is currently working at Gelfu as ophthalmologist. Of course, apart from, I know her very closely, we have been working for a number of years. Apart from the personal career as an ophthalmologist, she is also an assistant editor to Bhutan Health Journal, and of course, actively participating in public health and safety. The last speaker for this session would be Mr. Tsering Wangshin. Desup Tsering Wangshin, sir here is a regional coordinator for the Desup regional office located at Monga, and he is actively involved in the Desup related activities of 6 Eastern Dzongkhag, and sir has been a graduate of, as a graduate of Sherab's College again, like our Sherab sir, and he has served as various positions at various agencies before taking up at a current post of as a program manager at CPA Bhutan, which is an NGO working towards promoting alcohol and drug-free GNE society in Bhutan. So these are the 3 speakers, and we are excited and we are looking forward. So before we begin the session and with Sherab sir, I would like to request our participants who are looking and witnessing and following the session to drop your questions, your comments, your feedbacks, both on the Facebook live stream and also in the chat box. We'll try to engage as many questions as possible after our 3 eminent speakers have completed their talks. And to the speakers. So coming to the speakers, so you have 15 minutes to really sum up what you are going to really give in your as a talk, and maybe 1 or 2 additional minutes to really wrap up. And then once we finish with all three of our eminent speakers, we'll then have 25 to 35 minutes or 40 minutes of Q&A session. With this, may I invite Sherab Doji sir to give his talk. Sherab sir, the forum is yours.
Thank you so much, Dr. Karmala, for the introduction, and I would like to wish a very good afternoon to moderator yourself and Desup Sriwanchi and Dr. Chimi from Gelfula. Thank you so much for having me, and the organizers for having me on this conference. And my session, I want to share a presentation. My session, I just want to talk my experiences as initial experiences as a Desup myself, and how I saw volunteerism and public health in action through my course of work as a journalist. So I have simply titled my presentation as Volunteerism in Action and in Kind. So before I begin, I was not really sure how I would be able to do justice to this topic, since after the National Day address by His Majesty the King, who highlighted on all the works that were done by the volunteers on the front lines everywhere across the country and our health personnel. So I was quite worried, but I thought I'll just share my personal narrative. So I want to start by sharing a story. We started off the pandemic situation here in Samsila. We started off before the borders were closed. We started off by screening people coming in from the Samsi integrated checkpost and across all the entry points. in the Zonghak. And then initially it was the people from the Samsi General Hospital who were taking up the screening duties at the ICP in Samsi. But gradually the need for volunteers, I myself being a DESUP, the need for volunteers was felt because of the increasing number of people going in and out, and the short staffed at the Samsi General Hospital. So that's when us as DESUPs stepped in, and we started with all the screening and all. And then when the borders were closed, that was the time when suddenly the pressure was felt for the 100 odd DESUPs here in Samsi. And we had initially had to man about 24 points of entries in Samsi so that we ensure people don't cross the border illegally, Bhutanese going out or Indian coming in, because there are a lot of points here in Samsi where people can easily walk 5 meters and then you reach Indian settlement, or Indians can walk 10 meters and then reach a Bhutanese settlement. So those were the challenges initially. And so that's how we started. And let me put it this way, we started with nothing, basically nothing. It was just a tarpaulin sheet with a bamboo stick to put it up, and that's what kept us from the adverse weathers. By March, April, the monsoon, the summer rains were becoming heavier and more incessant. So it was that challenge initially, and then some areas didn't have cell reception in some of the points of entries. The POAs that I have done my duty at was in places where there was no cell reception at all. And the rain and the cold, of course, Samsi is in the south, but in the evenings at night, it becomes chillier. So there were some of the challenges. But one thing that stood out, which touched my heart as a DESUP, as a volunteer doing duty at the PO point of entries, was that it was a cold, rainy night. We didn't even know how to, we know how to start a fire, but we didn't think about starting a fire to keep us company through the night. And it was raining, and at about 9:30, a gentleman showed up. He was carrying a basket, and then in that basket, he had a flask of tea, a few cups, biscuits and snacks, and a tiffin full of lunch for, actually, I think in the picture that you can see here, it's apart from the one on the far left, the four of us were stationed at that point. We got to enjoy that meal from that gentleman. We don't know who that gentleman was. He just came in and said, "You all are here manning our duty, manning our border and keeping us safe from the border." So it's a small token from ourselves. He had already given lunch to our day volunteers that time, so it was quite a surprise for me and our friends. And then he told us that the men, they will be out doing their own works during daytime, so their wives have come together to cook us meals for dinner and lunch. And so that's how it was, and it was quite touching to start with. So that's a small personal narrative that I wanted to start off. And moving on now, that's the integrated checkpost in Samsila, where we had to do our duty. That's the fateful night that I was talking about, the rain and the cold and no fire that we had to go together. And the challenge really became tougher when the gates were sealed. We had, like I told earlier, we had to man a long porous border. Samsi has 183 kilometers of border, and currently there are 74 points of entries manned by 466 DESUPs. This is the figure. These are the figures as of November, or by 466 DESUPs and 306 Army, Police, Foresters, and His Majesty's retired armed force personnel. So right now, this many people are manning the border. Over close to 800 people are manning the border. So what happened was people kept coming. people kept coming, Indians kept coming. They had to repair their water pipes. They were coming in to look for work. And then Bhutanese were trying to cross over. They had people they know. They had to collect money that they had borrowed. They had to go buy ration and all. So people just kept coming. We had to send them back. And every time we sent them back, the Desups on duty were there to ensure that every time when these people crossed the border, information and advocacy about COVID-19 and and the preventive measures were given to those who crossed the border. And then all of a sudden, then my priority was my professional work as a journalist. So I had to keep my Desung duty aside. And that's when I saw the real dangers. Cases across the border kept increasing. I did several updates about the number of cases that were coming up in the neighboring Indian districts like Kalimpong, which is close by to Tendu and Norgegang Gyeoks in the west, and then Nagrakata, which is just 10-15 kilometers away from Tashicholing, Nasipsu Gyeok, and then Jalpaiguri, Alipurduar, Jagong, and other states. So cases were increasing, and then the volunteers had to be on guard 24/7. So that's when 24/7 manning of the point of entry started as well. And then as I told earlier, people were trying to cross into India and then trying to come in with narcotics and tobacco products. So until the lockdown in August, Samsi police had apprehended about 60 people in connection with trying to cross border and trying to smuggle in alcohol and then narcotic products. And then those people were subsequently sentenced by the Samsi District Court to a minimum of 11 months and then in between a maximum of 4.5 years in prison. So that's what happened up until the lockdown. Since the lockdown, the cases has been minimal, almost zero. People by then were aware about not crossing the border and then the implications if they did so. And then here, like I said earlier, 5 meters from crossing the border, then there will be Indian settlements, and similarly in Bhutan. And in most border areas, what I have noticed while going to those border areas to see how the situations were was that Bhutanese living in our territory had people who are related right across the border. And the most interesting thing that I saw and heard from the people was that they talk over the phone and then tell them not to come over. And then they also, after all the advocacy programs and advocacies by the volunteers and help people, they knew they shouldn't go out and the implications and the dangers of COVID-19. So that's how it was happening. And then initially it was all new to the Desups, to the people living near the border, both Bhutanese and the Indians across the border. Everything was new. And as I said, as the advocacy programs and all kept going, people understood. And then the number of cases where people crossed the border decreased drastically. So that's how it happened. When it comes to the volunteers, the Samsi border, as I said earlier, it's 183 kilometers right from, we call it Titring, it's Tempeling, where it borders Phuntsholing in the east, towards Upper Gyönpong, which is in Norgegang Gyeok. It's 183 kilometers. And the volunteers are not stationed in places where it is nearer to human settlement, and then I could see them, some drained, some fresh, excited to be on duty, and all the while they had one thing in mind. When I asked them, can you all sustain, can you all stay there for 1 month, 2 months, 3 months, if need be for years? Then all of them, despite the struggles, despite not being able to see their family, not being able to even take a proper bath, had one thing in mind. They said, we will serve as long as it requires, it requires. I'm sure later on Desup Chungwanchin will elaborate on this as well. So that's what I noticed. The visual here is of the GT stretch, the GT border. I will use a pointer here to point out where the border is. So this is the Indian border. On the right side is Bhutan, and then on the left side is India. So this is the Indian tea estate, and here is Bhutan. And then all these agriculture fields, paddy fields that you can see here is in the past years, they used to call people from across the border to help them in the fields. And I once went to this area right here where 3 of our Bhutanese people were working on the fields in time for paddy transplantation. So I asked them, don't you want help of laborers from people across the border? And one of the elderly ladies there told me that no, they do try to come in, but as soon as we see them, we turn our face the other way and walk away from them, because people in the Indian villages here have mostly dependent on our working on Bhutanese lands. And then when the paddy transplantation timings came and they were looking for work, but the situation so demanded that Indians and Bhutanese not come in contact. So it was quite heartening to see even villagers knowing and then trying to avoid people from outsiders, despite them having ready laborers to help them for their paddy cultivation. So that's one heartening thing that I saw. And then this is one of the notorious stretch. A lot of people were caught trying to cross over from this stretch. There is a small Indian town here at, we call it the GT town. So there's a small Indian town here. This is where people try to cross over to get their tobacco and all. And on this stretch alone, there are about 5 outpost stations, so that the volunteers like the SOPs, Army, Retired Armed Force, Police can watch over. So this is one of the notorious stretch. And that's it. That's how I saw our volunteers in action. And this is the final segment of my talk here. In the picture is few of the villagers who came together, collected sugarcane, cucumber, vegetables, curd, butter, cheese, and then came together to give it to the Desung office so that these can be distributed to our volunteers on the front lines. So this is just one picture. There have been a lot of people, a lot of incidences where the villagers just came in with a case of mineral water, a few bunches of spinach. So that's the Bhutanese spirit that I wanted to show. And on this note, I want to show one video. Before I get into the details of what the video is about, I just want to screen it and then see, and then give a brief about the video. So I hope our audiences will enjoy this video.
This is Simanadara in Tadingyo, which in Losam language means a bordering hilltop. It is a literal translation of the location, with this house here standing right next to the Indian border. Inside, the house owner Devi Maya Gale is prepping lunch for her housemate. Some 50 meters from the house is this duty outpost. Here, the housemates, their soups, forest rangers and police are keeping a close watch over the border. There are 12 of them. Devi Maya opened her heart and her home to the border patrol teams from the day the pandemic necessitated closure of border and strict vigilance of trespassers.
अब पानी झरेको टाइममा अब यस्तो बिमारको टाइममा अब हामीलाई त राम्रोको लागि त अब सरकारले ड्युटी पठाउनु भयो हैन अब असुविधा छ कतै क्याम्प हालेर बस्ने जग्गा पनि छैन अनि घर त मेरो खाली छ होस् अब ड्युटीहरु बसोस् अब रेड लिनु हुँदैन 1 महिना 2 महिना भनेर बस्नु भएको अनि अहिले 6 महिना लाग्यो सर अब वर्ष बसे पनि होस् अब छैन त सर बस्ने ठाउँ अन्त क्याम्प हालौँ भन्दा नि कहाँ भनेर चाहिँ मैले दिएको सर बस्नु
अन्ते
हजुर
बोलाको सब्जी के पकायो
सब्जी आलु फर्सी मटर पकाइदिन्छु उहाँहरू अब ड्युटीमा हुनुहुन्छ कोही बेला टाइम पाएको बेलामा म यताउति सफा सुग्घरहरू गरिदिन्छु अब सबै त केटा मान्छे हो सफा सुग्घर राम्रो हुँदैन टाइम पनि पाउँदैन अन्त म आफै कोही बेला टाइम पाएको बेलामा खाना पकाइदिन्छु सर अनि सरसँग सघाइदिन्छु कोही बेला यसो भाँडाहरू धोइदिन्छु सर अरू त छैन सर के छ र अब मैले सघाउनु के सब्जी टब्जीहरू दिउँ भन्दा पनि छैन सर हो यसो कामहरू चाहिँ सघाइदिएको नि सर मैले अन्त
Devi Maya says the security personnel are all like her sons now, and the feeling is mutual.
Gachidi na umdalu de semi saguno jodo zum chimina rangi chimna ondo zum bera nomel rangi chimna da kati jodo da rogi chimna jodo esta bideval mo sabe gachilab na misheval tenadi te umdalu de gachidi gato dobe chimna rangi chimna ondo zum bera nomel gachigi de rangi apa dai chika tini gokop ma de pesiro gachina obe chashubi kaplu nebe na jindam ge rangi buzum be tamda chawane be kina be omdalu tengashi singal hemagi no ngarage hemai ta samsa shosin hemagi duty sagona be sinde rangi soza te tisinami te charuchiga masi sago so jogo be tembe da titika toya tisasani matwa te anebe te tatuna be sindero achirage namro chiela taptabe te chim achirage chindama be da te tisina chini de te achirage nanale numawala ta tisinal to da to anwe dalu de te achirage chichi de time to chapsela.
His Majesty the King's relentless effort in keeping the borders safe is what inspires the 57-year-old. Thus, a little of what she has, she is willing to give.
राजा आउनुभयो यस्तो बोटोलाई राजाले त कति दुःख गरेर हिँड्नु भएको छ हाम्रो लागि हैन सर हाम्रो पब्लिकहरू बिमार नपाओस् राम्रोसँगले बसोस् भनेर चाहिँ राजाले पठाउनु भयो ड्युटी अनि हामी त के सर त्यो खाली सुत्नु त हो नि सर अलिकता सहयोग त्यति त हो सर अरू त सहयोग गरौँ भने केही छैन सर दिनु सक्ने छैन सर के गर्नु
Inspired, she sent her son for Desung training recently. Meanwhile, another lunchtime passes by. It is time for the patrol team to head back to duty stations. For Devi Maya, although she calls her role insignificant, another day in service of the nation is winding up. For tomorrow, she is all prepared. And for times beyond the coronavirus situation, she will be a testimony to the reality that amid fear, there is also community, support, and hope.
So that's the video. That's the video. Thank you so much for watching the video. So that's the Bhutanese spirit that I was talking about. And the volunteers on duty, whenever His Majesty during his southern tour came around, had something to give them. At one time it was apples, at other times it was snacks, for their Chubab celebration, at other times there was cake from Her Majesty the Gelson. So the small touch of grace from their Majesties kept the spirit in our their subs going. And every time when I meet them, when I went around to meet them, talk with them, this is what they mentioned. Their supreme commander is always thinking about us. So that's their spirit, and that's what keeps them going. That's what they tell me when I go meet them. And then so this is just people coming together to share some water with the volunteers, and then And then just before I go into the contributions made by people here in Samtse to the volunteers, what I visited that Devi Mai. I hope most of our audiences here know Falsampa and then was able to comprehend what Devi Maya had to say. And this news story was aired on BBS sometime in late October. And then as a spirit of unity, the spirit of unity that this story shows, as to show that we screened this video again during the 113th National Day celebrations. So I hope most of you, I'm hoping some of you might have seen this video. So when I visited Devi Mai prior to the National Day celebrations to get her felicitation for the National Day, I could see her son, whom she sent for Desung training, was already doing duty at her place. And then the duty personnel there were keeping the same spirit. And then life has been the same for Devi Maya. She has been helping all along. And I'm sure even now she must be, it's 2:11, so she must have fed some 8, 9, or 10 odd volunteers there, and then fed their lunch, and then she might be thinking about what to prepare for dinner, and then doing her cleanings like she does every day, like she has been doing every day for months now. So that's something that I think shows the spirit of volunteerism and Bhutanese-ness in Asla. So just now moving ahead, there were a lot of contributions made. The point of entries, the outposts, like I said, we only had tarpaulin sheets to begin with. And then as time went by, the contractors, the construction companies came forward, helped the Desups in constructing the outpost, a proper house to stay, to keep away the rain and chill at night. And a lot of contributions were made. Water is a case in point, like it's shown in the picture. And some of the people even supported supplying ration for the entire month for the Desups in Samtse, the other volunteers in Samtse. And as time went by, I did several stories about how volunteers are keeping up, how they are doing their duty, the challenges that they face, the challenges that they are looking forward to, and the motivation that is keeping them going. And as I through my course of work, and as I went on airing stories about the volunteers in action, what happened was, whenever such stories goes on air, not just on BBS television, but whenever such stories are written by the newspapers as well, the spirit of those who are on the front lines is lifted. It is lifted for sure. They tell us they tell us that it gives an emphasis about the contribution that they are making, which keeps them motivated to keep going for months and years on end if needed. So a small motivational post, a small appreciation post on Facebook written about them, they take that motivational post and stories with a deep sense of pride. And then, like I said earlier, this is what keeps them going, Lola. So that's why I through my course of work made sure that I did, of course, couldn't do stories about them every time, but I made sure frequently such stories are done to keep them motivated. And even some of the teachers who were on duty told me that they're happy that at least they didn't make the monthly salary that they get go to waste. So this is the sort of stuff that I got to hear from them. And in this picture, one of the friend is sleeping, but it's an early morning shot in one of the remote outposts along the Samtse Gomtu road, and one of the Desups is trying to meditate. And I want to talk a little bit about the mental strength with which our volunteers have been carrying on. Desup Nima Doji, who is a teacher at Tabadramte Lower Secondary School, has done 243 days of POE duty, outpost duty until now, and is still counting. His duty goes on up until early first week of January, so he still has some 3 weeks of duty to go. And the mental strength with which our volunteers carry on is really commendable, because there is tiredness, there is exhaustion. They do tell me that there is exhaustion. They do miss their family. They do want to be able to take a nice, soothing, warm water, hot water bath in their own homes, but they can't do that because they are in places far off where they can't even be browsing internet to save some of their boredom. And then, like Desup Nimadoji, there are 151 other Desups who have done over 100 days of POE duty up until now, and they have a few more days to go. And then this is the number of days counting since the point of entry duty started way back in March. And then there are others who are working in the Desung office here in the Samsu, have served over 250 days continuously. So this is the spirit that with which our volunteers have been going. Talking about mental strength now, since the topic is on public health as well, I just wanted to highlight what has the health sector done, particularly to ensure that our volunteers do not suffer from mental exhaustion. Physical exhaustion, obviously, yes, but mentally, how do we work to keep their mental strength going? And I think this is where we might have failed. The health sector might have failed. I'm sure Dr. Chimi later might talk about it, but I think this is one area where our volunteers were neglected. Although they took a lot of strength from the contribution and appreciation from the people from outside. But I think this is where, from a public health perspective, the thousands of volunteers who have been going on duty for days and months on end have been neglected to take care of their psychological well-being while on duty for months on end on desolate places like the one we can see in picture. And apart from that, I think the health sector, looking from the public health perspective, did a commendable job. This is a picture from a remote village in Dorokola, where when the lockdown was initiated, the Drunkhak, along with the health sector, ensured that the elderly people and those who are on medication got their medicines on time, and even ensured some of the initiatives taken were that they made sure they give escort services and vehicle services for expecting mothers, so that they can come to the health center for their regular checkups and all. So this all were ensured and continuous. So this is where we can take a lot of heart the contributions that our volunteers made and our health people made during the uncertain times of the pandemic, and especially when the ad hoc nationwide lockdown was announced. I think this is particularly what I wanted to highlight, and this is where I think I should stop. So I just wanted to show the will with which our volunteers and health sector people went ahead with their work without hesitation and with full dedication. And Dr. Kama, I think I'll stop here.
Yes, Sharif sir, thank you. Of course, we are running a little short of time, but it's fine. I think it is worth listening to every experience which Sharif sir shared. I think these small incidents is what going to be remembered in the history of what we did during the pandemic. Plus, we'll move on to the second speaker, Dr. Chimi, without much delay. Dr. Chimi, again, just a reminder: the time is 15 minutes, and you might have you might take few minutes more just to, in case you can't finish. But my request is we would like to hear more, listen more, and try and answer to so many questions which is already dropping in. Okay, and kindly keep it within 15 minutes, and if at all, maybe 1-2 minutes extra. Last floor is yours, Dr. Chimi.
Thank you, organizing team, Bhutan Biodemocracy and Resilience Conference 2020, for choosing to have me as one of your speakers. Thank you, Dr. Karma, for the intro. Thank you very much. Kuzu Zampola, Your Excellency, organizing team, moderators, fellow speakers, and dear audience. I am humbly honored to be presenting on this pertinent topic, public health and volunteerism. I shall now share my slides. So yeah, coming to public health and volunteerism, what is public health and how prepared were Bhutan as public health wise at the inception or at the emergence of the pandemic, and how did volunteerism bring about changes for good in our public health sector? So let me begin my talk by going to the very basics by delineating public health. Atchison stated, public health is the art and science of preventing disease, promoting health, and prolonging life through the organized efforts of society. Thus, societies within the community are very important parts of public health, and public health essentially is collaborative health or collective health with collective responsibility. So public health is very much a people-centric approach to health, where every one of us must take charge for our own good as well as for the good of others. Now, a very broad concept of health, or say a grand concept of health, is holistic health and wellness, where we focus not only on physical aspect of health, but it encompasses other aspects of health, such as the intellectual health, the emotional health, the environmental, occupational, and spiritual health. So in that way, holistic health, it also encompasses that essence of spiritualism into health. In Bhutan and globally, the public health sector had been taken at stake by major challenges, and this 2020 is the novel coronavirus pandemic that had caused major disruption and caused threat to cause major challenges to the public health. And apart from the disease itself per se, it has caused other major public health challenges along with it. The major ones being mental health issues, where they are scientifically proved increased cases of stress-related disorders, anxiety, depression, and increased suicidal rates. And also with the pandemic, preventable infectious disease is on the rise. This is because of the lockdown in place with the pandemic. It has forced a pause to the routine immunization schedules, and vaccine preventable disease could be on the rise. And also because the pandemic had caused major disruption to diagnosis and treatment of otherwise treatable illnesses such as tuberculosis, tuberculosis, HIV, and vector-borne diseases. And with the pandemic, food security was also at stake, putting into consideration both the affordability as well as availability of the food. And because the COVID-19 pandemic, it's an emerging disease, a new disease, so we do not have any previous data, previous information, insight, or knowledge into it. So because of this lack of scientific data on the illness, there's per se no pre-written treatment and for this illness. So this has all posed major challenges to the public health. Coming to the novel coronavirus COVID-19 pandemic, if I highlight a very brief timeline at the emergence of the pandemic, first of cases of pneumonia from Wuhan in China on the 31st of December 2019. It was indeed a very unwelcoming event on the eve of New Year. And later, a novel coronavirus was found to be the cause of that pneumonia. And 1 month down the line, the Director General of the WHO, they classified that outbreak as a public health emergency of international concern. And 2 months down the line, WHO, they were deeply concerned with the alarming level of both the spread and severity of the disease, as well as with the alarming level of inaction. And with this, WHO, they did an assessment and they characterized these public PHEIC as a pandemic. So pandemic essentially is an outbreak of disease which occurs globally across international borders and affecting large group of people. And this pandemic, it has posed unprecedented challenge globally, be it to public health, economy, and our food system. And at a global level, what they did was the WHO, the UN Foundation, and their partners, they came up with the COVID-19 Solidarity Response Fund that was launched to collect donations from individual corporations and institutions. And subsequently, they have conducted solidarity trials to collect robust data from across the world and to come up with effective treatment for coronavirus, COVID-19. Coming to pandemic, the coronavirus pandemic, COVID-19 pandemic in our context, in context of Bhutan, I'll talk very briefly on the public health system in Bhutan and on how prepared were we at the emergence of the pandemic, the provision of our health services during the COVID times, and how our health system innovated to meet the needs of the changing times. I'll also talk on role of volunteers in public health and in what way did volunteerism change things and about the healthcare during the new normal once that national lockdown was lifted. So coming to Ministry of Health, as with other ministries, the Ministry of Health under the Honorable Minister for Health, we have the Honorable Secretary, and then we have like the quality control, the internal audit, and policy planning divisions. And subsequently, we have 5 departments: Department of Medical Services, Department of Medical Supplies, Department of Public Health, Department of Traditional Medicine, and Directorate of Services. What I will be focusing today is mainly on the Department of Public Health. And under that department, we have offices for non-communicable diseases, communicable diseases, public health education, and public health promotion division. There's also vector-borne diseases, and we have the Royal Center for Disease Control, the people of which had been working tirelessly for past many months since the pandemic, COVID-19 cases came to our country. They have been working tirelessly to test all those patients and also to test all the contact tracing. So coming to local pandemic preparedness in our country, we had the first confirmed case of COVID-19 on 6th March 2020, when an American tourist traveling from India was found to be positive for COVID-19. So in that way, like Corona, he took a daring move and like was brave enough to come to Bhutan uninvited. And as is globally, it is an unprecedented event in our country as well. Yet we were blessed because we had our guidance from our monarchs, our visionary monarchs. And that way gave us a source of inspiration, emotional support, and guidance was there, and the government was well prepared. They were very prompt in their action. They took well-informed decision, and they brought about immediate action. And of course, because it's a new disease, an emerging disease, and we do not have pre-existing guidelines, so new policies and guidelines have to be developed, and they had to be implemented at a rocket speed. And these were there. And another blessing we had is at the inception, at the emergence of the disease, we had a good number of DSUP volunteers, all thanks to the far-sighted visionary leadership of Majesty the King. And guiding forces from invisible forces, or say superpower, were also there, I should say. Yeah, coming to the pandemic response plan, abiding by the national pandemic response preparedness and response plan, immediate action was initiated, and everything was personally overseen by His Majesty the King and Honorable Prime Minister and health and a team from the Ministry of Health, led by the Honorable Lempo. We're working tirelessly and led those efforts, and the actions we had, like a contract tracing of the patient who first tested positive, and immediate response plan. Response action where like closure of schools and institutions. First in 3 Zongkoks, there was temporary ban on tourist entry for first 2 weeks, and public health awareness on this emerging disease were increased. Both health promotion, health education were there, and subsequently there were travel restrictions and quarantine facilities for isolation came into place, and of course, the public and healthcare professionals, everybody had to abide by COVID-19 protocols, and there were attendant restrictions to the hospitals. There were strict restriction of food and beverages to the hospital, and food to both the patients and attendant were provided free of cost. Of course, we have free health services. Foods were also being provided both to patient and attendant by the government. And we also had entry and exit scans and checks at hospitals or vegetable markets or large crowd where there are large crowd gathering. So these are our response plan. And on 11th of August 2020, when a positive case of COVID-19 was detected in Gelifu, the nation had to be put under lockdown to secure the nation from the effects of the pandemic. And public showed immense support and solidarity. There was strict adherence to protocol, and that in a way showed that unity and communal harmony do exist within the communities in our society, and that really gives a very positive vibe. It's a very good sign of positivity, and people really were adhering to the COVID protocols. I could see everybody wearing masks, so that's a very good sign. So coming to volunteerism in public health, in Bhutan, our DSUPs or our orange-clad guardians of peace, our Peace Corps, they form the epitome of volunteerism in our country, and they really did a lot for the country at the time of pandemic. And what is volunteering? Essentially, volunteering is acting in recognition of a need without expecting anything in return. So it really is a very selfless act. And coming to volunteerism in our Bhutanese context, it is driven by our traditional belief system and our religion and community practices. And historically, we have that cultural institution of Kidu, which existed since the time of our first monarch, and which as a royal prerogative, they provide for the well-being of the people, especially the needy section of our population. And this Kidu system, it magnified multiple fold during this pandemic time, and where people were like, forget about others, they're even receiving monetary benefits like salary on a monthly basis from the government. So that's a very great thing the government is, the king and the country is doing for its people. Coming to provision of health services during the pandemic, to the best of abilities, emergency medical services were provided unhindered 24/7. And toll-free numbers were made available, essential toll-free numbers at the national level and region-wise in Eastern region, Western region, and Central region. There were COVID-19 toll-free numbers, the health center, and toll-free numbers for medication refill, elderly care were there. And there was like a quarantine and quarantine and surveillance team in various regions. They have come up with the quarantine and surveillance team, and separate flu clinics were set up, and all thanks to Bhutan Red Cross Society. They provided us with tents and separate flu clinics were set up, and these could not only decongest the hospital, but at the same time prevent spread of flu and probable COVID-19. So these were of a great help, and also to meet the changing need, mobile clinics were set up. And in Gelifu, we set up a mobile clinic which was run by Dr. Kuru, and that ensured that the patient with long-term illness got the medication on time. And routine maternity and child services, especially when it comes to immunization, contraception, and maternity care, were provided unhindered. And Red Cross Society, Bhutan Red Cross Society, they provided free taxi services. That way, it facilitated people to travel to get these services. So, as mentioned earlier, coming to role of volunteers in public health, in DSUPs the Guardian of Peace, they form the epitome of volunteerism in our country. And the first DSUP program was initiated in February 2011 under the patronage of His Majesty the King. And during the pandemic, we are very much aware that the DSUPs played a huge role. Like in hospitals, they were managing the crowd. This is the medical superintendent in Gelifu Regional Referral Hospital, provided pins for DSUPs as a sign of gratitude. The DSUPs were patrolling the border. That way, they ensured that there is no influx of positive cases into our country. And also, the DSUPs, they looked into provision of essential services to the essential goods to the people, and ensured their demands are met, like ensured food security and food safety. So they really did play a huge role. And another organization that really came forward was the Bhutan Red Cross Society. So Bhutan Red Cross Society, as mentioned earlier, they provided free taxi services. And one thing they really did for the good of the country was they took the role of managing the dead body. And at this time of adversities, they ensured that dead bodies, which are a sensitive thing in our culture, are given importance, and it ensured these were treated with respect, and that those grieving families were taken care of even during the time of adversity. That was a very nice thing they did. And they also facilitated travel of patient, public for medical emergencies and personal emergencies. They ensured like people get their routine health care services, such as vaccinations, are being done on time. They were also managing crowd in the vegetable market. And other voluntary moves that came. Actually, I have this in thing. The slides are supposed to come one after another, but they're not coming. So other voluntary moves, they include the hotels providing food for free. For the fatigued healthcare workers. They were healthcare workers who were the frontliners who were really volunteering their time and expertise for prolonged hour a day, especially in the heat of Gelifu. They were laboratory workers who were like really clad in thick suits and working in the heat day in and day out. And the picture here shows a very presentable hand washing facility at the entrance of the Gelifu Central Regional Referral Hospital. This is also due to voluntary contribution. We got that. And we all know that hand washing practices and also hand washing techniques, they increase multiple-fold during this pandemic. This is an added benefit with all the protocols that were put in place. This ensured not only reduction in COVID-19 transmission, but also flu, diarrheal illnesses, and also reduced antibiotic resistance. And fundraisers were of all sorts were there in communities and online and like social media fundraisers were there. And these in a way they ensured that sustainable kind of volunteerism ensured that these the voluntary activities kept going. At such times of adversity, the frontliners frontliners, the healthcare workers, the public, the patients who were contacted with COVID-19, there was a huge source of guidance and inspiration from all levels. We have starting from our monarchs, we have our king visiting the country all over, His Majesty the King, and His Majesty the Fourth King. He personally visited the Galifo Central Regional Referral Hospital and met with the patients, and that was a great source of inspiration, not only for us, the healthcare workers, but also for the patients and for the public at large. That gave us a lot of motivation, positive vibes to keep things going. And Our Majesty the King, he was also traveling all around the country. I went to many dry ports, seeing the workers there, and overseeing every kind of protocols that were in place, and that really made people going. And of course, we have a very proactive Prime Minister and Minister for Health, who are always there overseeing all those activities. So in that way, we were lucky. So coming to kind of end of my presentation, what we learned from this pandemic is it taught us that health is everything. Health is not just wealth, but it is everything. And holistic health should be our mission. As I mentioned earlier, we should not just focus on our physical health, but every aspect of our health, emotional, mental, spiritual. The essence of spiritualism has to be there. And let's all volunteer for a change, because volunteering is really a transformational thing. It can cause mindful transition in oneself, and we all look for change, but then change actually should begin from within. So only then we can change. So let's all volunteer, and let's all make a change so that we make our community our neighborhood a better place to live on. And looking on to a future, in Bhutan, we do have platforms for volunteering. We do have lots of civil society organizations, but still we can come ahead with more platforms for volunteering. And digital volunteering could be in place now with the pandemic thing, and with the social media use, digital volunteering would reach more number of people. Yeah, Bhutan, this pandemic, till now we have been successful. Ours is a small country, but till now there were no deaths, so we had been successful. And His Majesty the King, during the address to the nation on 22nd March 2020, I quote, "As a small country with small population, we can overcome any challenge we are faced with if the people and the government work together." Indeed, a very visionary statement from Our Majesty the King. Yeah, together we can defeat the COVID-19. Till now we have been successful, but we now have the second wave of COVID-19 coming up, and our capital, Thimphu, is lockdown restrictions have been placed there. And I humbly pray, and I'm very hopeful that we'll come up with the same outcome. And I, Chimyongmo from Galifo Central Regional Referral Hospital on Ministry of Health, I assure that we continue to provide our continued services to the best of our capabilities, and we also expect the same support and solidarity from the public. Let us all join our hands, work together in unity and in communal harmony, and let us all save our country from this pandemic. Tashtele.
Yes, Dr. Chimi, thank you. Thank you for a quite a huge volume of experiences, and touching on the wide variety of domains and areas. I'll take 1 minute before I hand over to Sri Wangchan sir. I think the pandemic has taught us many things. There are n number of things that it has taught us, but one thing from the health perspective, which is essentially something that we must look at for the future and really seriously explore if we can really do it. The concept that which Dr. Chimi is a slide contained, one concept called people-centric approach to health service delivery. If we are to really overcome the pandemic, if we are really to overcome similar public health events in the future, public or the people-centric approach to health service delivery is the answer, is the solution. But when we do that, the tool or the vehicle or the mechanism to do or the strategy to do is again a lot of volunteerism will come into picture. That's why I was saying right in the upfront that these two match well. They are the couple. Without one, the other won't be successful. Of course, the volunteerism could be successful because it also will involve other areas, but health will depend, especially the people-centric approach to health will depend a lot on the volunteerism. Okay, with this note, not with further delay, may I request Tsiring Wangchen sir to take over, sir. So next 15 minutes is yours, plus. Thank you.
Anyway, first of all, thank you, Dr. Karma, for the introduction and for giving me this opportunity. May I also take this opportunity to thank the Center for Local Governance and Research, then also the Center for the Study of Democracy, University of Westminster, United Kingdom, for the opportunity to be part of the Bhutan Biodemocracy and Resilience Conference 2020. So I'm asked to talk about or speak about volunteerism in Bhutan. So first of all, let me share my view about volunteerism. Of course, as of me, as per the Lord Shantideva in the Way of Bodhisattvas, what Lord Shantideva has mentioned is he talks about that all the suffering in the world comes from seeking pleasure for oneself, and all the happiness in the world comes from serving others. So what I mean to say here is, I think volunteerism is all about serving others, and as a Desup is also about serving others. Now, first of all, I would like to request the viewers here to give a few minutes. Imagine Bhutan without Desup, especially during this pandemic. What would be the situation in the country if Desups were not there? With this, let me give a brief background of Desup. As per the royal command of His Majesty the King, the Desung Integrated Training Program was instituted to be a value-based personal development program with the main objective to encourage all citizens to be active in the role of nation building, referred as Orange Warriors. So I have also used my background color of the presentation, the orange color. The Desung logo also is based on the traditional Bhutanese design, and it has 5 different colors. Here we have the symbol of the monarchy. The Vajra also symbolizes indestructibility and fearlessness, which we really need at this moment. Through these training programs, all Desup trainees are expected to appreciate the sense of community, harmony, and cooperation as a group and as active members of society. The underlying premise of the training program is built upon the spirit of positive influence of ethics and values of community service, integrity, and it is also expected that any citizen who have undergone the training program will actively volunteer during disaster operations, participate in charitable activities, and be of service to others throughout their lives. And these are the core values whenever we go for duty. And these are the core values we are reminded with the unity, the harmony, the integrity, duty, and courage. Let me also share the current DSUP status. Since the establishment of DSUM office in December 2010, the first batch DSUM integrated training program was launched on 14th February 2011, which is now every year 14th February is celebrated as the DSUM Raising Day. Every batch till 38th batch, we had the DSUM institution used to train 125 trainees. Since then, both youth and adults from the civil service, from the private, from the corporate sector had joined the DSUM program, and we now have an amazing of 18,341 DSUP as of now. We have male DSUPs of 11,856 and female of 6,485. And in the east, we have, which comprises of 6 Dzongkhaks, which I look after. We have a total of 2,558 DSUPs so far, and this will increase because again, the trainings are still continuing. DSUPs until the 7th batch were expected to participate in firefighting, search and rescue operation during the earthquake, in road accidents, flood, and landslides, and manage huge gathering of people in public areas. These are the achievements of DSUPs before the pandemic. Like in June 2012, DSUPs helped armed personnel and volunteers to battle the Wangde Photong Dzong, which was on fire, and save relics. Then in April 2015, 22 DSUPs were deployed as part of Bhutan's first international relief team during the Nepal earthquake. The voluntary works are not just within the country, but it goes beyond the borders. Then on 2nd June 2015, good number of DSUPs, you can see the picture here, also set a Guinness World Record in terms of tree plantation in the country. Then in November 2018, about 120 DSUPs accompanied His Holiness the J. Khenpo to Rajgir and Bodh Gaya for the Melam Chenmola. These are some of the achievements made so far. And during the pandemic, with the COVID-19 pandemic, the training was accelerated with the focus to train as many youth as possible and deploy them all over the country to prevent the spread of the virus. So we have been involved in loading and unloading of essential goods. You can see the picture here. We have been also involved in distribution of medicines for the elderly citizens under the command of His Majesty. Then we have also been assisting health personals, as Dr. Chimi rightly mentioned, in terms of screening, in terms of managing the people visiting the hospitals, like following the COVID-19 health protocols. We've been also involved in creating awareness on COVID-19 protocols, on hand washing, on wearing of face masks, so on and so forth. We have been also involved in surveillance and patrolling in collaboration with the law enforcement agencies like Royal Bhutan Police. To continue further, we have also, until now, we have sent about 500 Desups to southern border duty. These are some of the pictures here. Then we have also sent 5 batches of Desups, especially from the Trashigang and the Trashiyangtse side to the northern for northern border duty. You can see one picture here, this one. So, and these days we are also sending 100 Desups in each batch for a special refresher course, which is held at Dewathang and at Tenchuling. For the eastern regions, special refresher course is held at Dewathang, and this third batch has already been sent just a few days back. And even a first batch of search and rescue training has also been completed. The second batch will also start soon. Maybe because of the lockdown, the training has been deferred until further notice. So these are some of the activities which the Desups are involved in, and not only just in terms of COVID-19, but in terms of pandemic, Desups has been also involved in our usual activity like constructing of houses for the needy ones. Here you can see that here the Lindsay Desups have come up with a small house there for the underprivileged citizen. These things are also going on, not just volunteering on to combat COVID-19, but other works which we usually do, we also continue to do that. Then with the visionary leadership of His Majesty the King and inspired by His Majesty's royal address to the nation on 12th September, training from 42nd batch focus Desups to be trained on water source management. So Desups are now also engaged in drinking water supply project and integrated again drinking and irrigation channel project also has started in Sirang. This is the picture here, and 3 more projects. One is in Kalapang, Mongar, which was launched on the National Day, and the other 2, one will be in Tangdung, that is under Trongsa, and the other one in Kamji, Chukha, are scheduled to be taken up very shortly. And interestingly, if you look at this picture, the moment that they arrived at Kalampang, they were received by the villagers with vegetables and juices they were so excited to welcome the Desups so that now they can have water for agricultural works. And because of all the works carried out by fellow Desups, this year on the National Day, His Majesty recognized the institution with the award. With this, let me close my presentation with a prayer, which goes like this: May Bodhicitta, precious and sublime, arise where it has not arisen or not yet come to be, and where it has arisen may it never fail but grow and flourish ever more and more. So ani ngache tunna zumji bewachin janju semcho rinpoche ma ke panam ke jurji kyaba nyamba meba yang kongne kondu pewa sho se gemuludu gismu zumbe tani gibe. This is the end of my presentation, and I will delve more on the question answer session, whereby I will try to share some of the experiences. So I would like to request the viewers here to pose questions. Thank you, Dr. Kormana.
Lasla, Thank you, Tsering sir, for a wonderful talk, full of experiences and lot of achievements, lot of contribution of Desops in the East. I think these are all experiences and incidents and events which are heartening, which gives us lot of hope. And I think it is at this point correct to mention that I think we can with much surety we can say that Desops is a synonym to volunteerism in Bhutan and vice versa. And with this, now I'd like to open the forum for question. And I have listed down some of the questions that came through in the chat box, and also some one or two from the Facebook. I think this was one question was particularly directed to Mr. Sherab. So the question was, can you feel any difference going to those places as a Desub and as a media person? Or what kind of spirit does people show towards such differences now? I mean, so in relation to the COVID and in relation to experience of last 9 months, I think that's what it means. That I could get that from the Facebook. Lasla, Sheriff sir, floor is yours.
Thus, as a Desum myself personally, it was more like knowing the personal struggles myself, lah. And then as a Desup, we do discuss the personal struggles among ourselves, but we keep ourselves motivated and all. But as a media professional, when I go into the field, when I talk with them, it is more about them. They might be one Desup at some entry point might be thoroughly exhausted, thoroughly maybe drained of energy and maybe demotivated as well. But once they come on camera to speak to me, they know that it is their responsibility to not show that the drained energy in them. They know that they are the representative of the entire Desung fraternity, and if one of them shows some tiredness, and then it may have ripple effects. So despite the tiredness, they know that what they say would have impact on their fellow Desups. It would have impact on me and my perception as well. So that is why they ensure that to keep that, I was using the word motivation a lot. So keep that motivation going. They make sure that they talk about all the positivity so that the positive stuff will spread to other Desups across the country, not just here in Samchi. So when it comes to motivation, I didn't see any difference. I didn't see any difference. They do get rest. Some haven't rested at all. Like Desub Nyemodoji, I mentioned earlier, he haven't rested, but he's still going strong. Some do get months rest in between. So every time when they come back, they come back with full josh, as they say in among themselves. So that's, I don't see much difference.
Sheriff sir, thank you. I mean, this is my personal question. Sorry, I'm asking this. No, I think in Sheriff sir's presentation, you mentioned, especially the experience of Samti, almost 183 kilometers of very porous border. I remember when I also had an opportunity to travel to the Perjuling for a COVID session with the Desub badge. It was very porous. I think you are right when you said that the border is just at stone throws distance, and and on top of that, a very porous border to guard with, and then on top of that, you had a very minimal resources to really support you through that journey of serving to the nation and serving the nation. So the question here is, now I think it is a very open question to both Tsering sir and Sherab sir. You two of you can, either of you can take, or both of you can take up. What kept you going during these difficult times as a Desup, especially as a Desup? I'm asking this as a Desup. Lasla. First, maybe Tsering sir and then Sherab sir can top up.
Lasla, thank you for the question. I would just make it very short. For me, what keeps me going is the leadership role played by His Majesty is playing, and it has been really crucial during such a pandemic that I think in the most cases, what most of the leaders do is they just pass on the instructions. But here in Bhutan, we have His Majesty traveling to nooks, traveling to the corners of the country and ensuring how DSUPs are performing their duties, and then what are the challenges that DSUPs are facing, and immediately these challenges are and just to share my experience, I got the opportunity to have an audience with His Majesty when before the COVID-19 first case was detected in the country. His Majesty came to Mongar, visited Mongar, and just a few days back before the case was detected. And His Majesty told the people involved in preparing the plan. And during that time, we were discussing especially the governors of the districts, the zongdas of 6 system. I think that during that time there were 5 zongdas, and the police SPs were there also. We were trying to come up with a plan how to combat COVID-19. But we were not able to come up with, because there was no clear direction. Then in between our discussion, His Majesty again came and then told us that we should not be planning based on if, but it should be based on when. And then immediately after, when His Majesty left, the direction gave us the direction how to come up with the plan to combat COVID-19. And because of this, during whether it is when the first case was detected or during the first lockdown, we were able to do it in a very smooth way. So basically what I'm trying to say is leadership played a very, very important role during such pandemic.
Thank you, Siring sir. Sharaf sir, if you would like to add something.
Yes. I'll keep it short. I will not what kept me going, but what kept them going. I'll put the DSUPs in perspective. What kept them going was their Majesties sharing muffins, cakes. What kept them going was the apples, the chips. What kept them going was people like Devi Maya and other people across the country who showed up with vegetables like Srinachi sir showed earlier. So that's what kept them going. What's kept them going was people in the media putting them in the limelight, showing the work that they are doing. So I think that's what kept them going. Otherwise, it's really difficult to be standing in a desolate border area with no one inside for hours on end, standing there, sitting, just gazing into the wilderness. Otherwise, that would have been near impossible. But I think us Bhutanese kept them going. That would be it, sir.
Thank you so much to both Siring sir and Sharaf sir for answering this question. I think, again, just to top up on what I saw, a small experience I saw when I was traveling to Perjoling in around, I think, mid-June in early this year. I think along I saw n number of posts, and as rightly mentioned, in some of them we could hardly call it a post, but we saw our orange dress guardians, sitting there, standing there, and then guarding the borders. I think it was a very touching, at the same time, a very satisfying moment to say that we are Bhutanese who are serving our nation to the maximum of our capacity, right? So thank you, thank you. I just shared my experience. Now, next question goes to Dr. Shimi. I think this question was there on the chat box again. The question was that I know, Ministry of Health and the other relevant agencies actually worked very hard to develop, plan on especially when there was a bird flu outbreak in 2010, and then they developed a wonderful document, it seems. But however, the operationalization of that plan, particularly when there was a public health event of this nature, was a little bit less desirable than expected. Now, going forward with the rich experience from COVID-19, okay, which is both good and there are, of course, shortcomings. How should Bhutan react to the aftermath of this, pandemic, to create and to prepare a very robust and a holistic pandemic preparedness plan that can truly encompass all the societal approach, with the very clear roles and responsibilities. Would you like to add anything, or share your perspective on this question, Dr. Chemi?
Thank you, Dr. Karma. Thank you very much for the question. As I mentioned earlier, Bhutan, for us, a small developing country with limited resources, what our the country, the Ministry of Health, overseen by His Majesty the King and our Prime Minister, what they did, I feel I have my greatest gratitude, respect, and inspiration. Appreciation for all the works they have done. We have been very successful till now, but having said that, it doesn't mean there are no ways for improvement. We can always learn from these experiences, and I do not have anything specific to say, but then because also this topic is on public health and volunteerism, so the policies should come at a very grassroots level to very basics, because ultimately it's the basics. People go into hi-fi sophisticated things, but ultimately what really matters is the basics. So we have to come up with policies that can really be implemented at a grassroots level, and we have our organizing team from biodemocracy, like sustainable democracy. So in that way, we also have to come up with health guidelines that are sustainable. We never know, down the line we may have more such issues, like be it epidemic, pandemic of all sorts. So we really have to come up with contingency plans so that these are carried forward in the future. This could be reproduced. We do not have to start from ground zero. So we have some basis. So the public health and collaborate. It's not just ministers. Okay, so what I mean to say is not just the responsibility of the health care workers or the public health or the Ministry of Health per se, but it's responsibility of everyone. We should be it at a very minute level, we should come forward. It should start from within. So if we really change ourselves and come up with positive things, it will really work for our own good and for the good of others. So basically, it's like if every one of us take charge for our own safety, it's like we're not just taking care of your own safety, but for the good of others as well. If one do not get, then there's no chance you'd spread the disease to others. So likewise, what I mean to say is when you implement, I have no comments on policies and all, but this should be something very practical, and public support and solidarity has to be there. And for what the Ministry of Health did till now, I have my greatest appreciation and gratitude. I am very positive. We learned from our past lockdown, and with the second wave, we have more knowledge, and I am very hopeful. It doesn't mean we have to be lenient, not complacent, but then we can always move forward with the lessons we learned. Thank you.
Thank you so much, Dr. Chimi. I think I would like to add, Dr. Chimi, on the various points, of course, she mentioned. One thing we must appreciate and we must realize as we move forward, taking the experiences from the COVID, is that Bhutan as a nation, which is a nation of free healthcare, and for this, many of the countries appreciate Bhutan's approach to health systems and healthcare delivery. We still spend less than 4% of our GDP, and which is much sort of less from many of the countries' perspective, even where it is not free. So when you really look at having a good plan, I think resource does matter. And then this is something from the policy side we should look at. How can we increase investment in healthcare delivery system? That's one thing. The other one is we must look at, yes, we might have good plans, but then we must have a very strong leadership in terms of somebody who can see through the health systems, who can dissect the health systems. So this is again an important aspect if you really look forward, because if you don't take these lessons into our stride as we move forward, then it would be a sort of another sort of a pandemic comes in, and then we'll still be again experiencing. So that's why leadership again does matter. So therefore, of course, we are fortunate that we have the public health specialist as our minister. So that way, I think leadership is not a big issue. But however, the resource still remains a challenge, and I think this is all about prioritizing. So this is what I would like to top up. And moving on, I think to Tsering sir and Sharaf sir, one question was, these days our youth have no sense of volunteerism or helping others, and how do the experts here believe that we could encourage our youth to take up more volunteerism in the future? So maybe we'll begin again with Tsering sir and then Sharaf sir. Thank you.
I will disagree that our youths are not into volunteerism. I will totally disagree, because through experience during this pandemic, most of the DSUPs who are coming forward are the youths, are the unemployed youths, and they have been rightly engaged. They are in the borders. They are also in the Zonkaks. Here currently in Mongar, we are doing our DSUPs are doing duty at the Mongar Regional Referral Hospital as well as the vegetable market. And there we have most of the DSUPs who have come forward are youth DSUPs, and some of them are also given a lodging facility here at Desung Clubhouse. I also manage the Desung Clubhouse in Mongar. So they stay here. They are, of course, just the lodging part. Rest they have to manage on their own, the foodings, so on and so forth. So that is why I would disagree that youths are not into volunteerism. In fact, they are into it, and they are contributing a lot. Say, Junila, less.
Thank you, Sharif sir.
My question would be, why should it only be the youths who have to volunteer? They have been doing, even Srivanchan sir talked about young DSUPs. When we didn't have the DSUPs coming out of training centers in mass, people from the villages, the young people from the villages were coming out to do duty. So I think it would be wrong to say, like Srivanchan sir said, that young people aren't coming forward. Of course, there are people who are not coming forward. Let's keep them aside, but people should come forward. But I think it would be wrong to just directly say that young people aren't coming forward. Those who are coming forward have coming forward in thousands, and then the district training centers have trained all of them, everyone who have shown their interest.
Yeah, thank you, sir. I think I also tend to agree with both the sirs here. Again, when I was traveling to Samsi, again, my experience is with Samsi, because I have somehow my duty was always in that side. Again, when I was traveling in May and June, I saw one DSUP at one of the station, and then the other two were young boys and girls. I mean, they were, other who were accompanying him. Was a, to me, they look like very much like maybe in their teens, and probably high school students, who were there at home because the schools were closed. And at the back and the front, I saw friends of the community. Is it something? Yeah, if I remember correctly. Yes, Sharaf sir?
Yes.
So I think our youths were actually, and they are coming forward. So maybe, but still, it's for discussion. So that's why I proposed the question as what was dropped. So moving on, since we have maybe a couple of minutes more, I would like to throw up one more question, and I would like to request any of three panelists to answer this. From your perspective, from your individual perspective, what is the biggest challenge faced by volunteers in dealing with the community and public during this community and this COVID outbreak of, and our experience is almost 9 months. So that's why, I mean, it could be, it could come from health perspective, it could come from a media perspective, it could come from a, DESO perspective. So I'll open the forum for any of you to answer, and then maybe we'll start with Dr. Shimi then. Let's.
So yeah, thank you, sir, for the question. So coming to like the biggest challenge the volunteers are facing, I would say is like with on human grounds, they are volunteering themselves for the good of the people, but at the same time they are putting their own health at stake. So like safety wise, and also it's a huge physical and mental toll for them. So like that way, like the mental health, they will like they will be there, but for how long? So but then for us, a blessing thing was our monarchs, kings, where their prime minister and all sorts of solidarity and support kept pouring in. That in a way kept the volunteers going on, and in a way that helped their well-being. But looking at some of the DSUPs who are at the outposts, their shelters, their food security, food safety, how safe are they from say the wild animals? You never know. So their safety has, because we have to sustain these things. We never know how long the pandemic would go for. So for me, I think like also personal protective equipment. For now we have enough, like especially for the healthcare sector. Down the line, if things keeps going, how are we going to sustain this? So this I feel like for on human grounds, but they are like serving for the good of others, but this doesn't mean they can put their own health at the stake, because down the line who is going to come and volunteer, so kind of thing. So this I think is one of the biggest issue. Their own health, wellness, every aspect of health and the psychological impact is being put at stake.
Yes, thank you, La. Maybe Sharaf sir, would you like to go this time first?
Leslie, just briefly, I will say it would be all the effort that we have put in up until now would be complacent people. We can't put DESUPs and army and police in every villages and in every town center. People, we have to guard our 700-kilometer long southern border and all the border across the north. So just last month I was at not even last month, a couple of weeks ago I was in Doroka town. It was like no mask November. I couldn't see anyone up there wearing mask. Obviously there was no DESUP monitoring up there, because people, when they see DESUP, they tend to put their masks back on. In Doroka, I didn't see any DESUP, so that's why I think none of them had their mask. So I think people should start taking responsibility to keep social distancing, to keep their masks on when they are going into public spaces. And this, I think I say it with quite a bit of worry, because apart from Samtsi town, where there is DESUPs monitoring everywhere, away from the towns, in the villages, in the small village centers, in small towns, in the Jonkouts, I don't see people adhering to wearing masks. And then QR code scannings, the Druk trace scannings. I can't even see that being done right now in Samtsi town, the scanning and visitor logging on the books for those who don't have Druk trace. So I think complacent people is the biggest risk for now. That would be it, sir.
Let's Tsering sir, you are the last one to go here.
If you really think deeply how to combat COVID-19, I think it's nothing, it's doable. It's very simple. Just follow the COVID protocols, that is wearing the mask, maintaining social distance, using the Druk trace wherever you go. That's it. But I don't know. I think I totally agree with Sharaf sir here. It's one thing is about complacency. We are complacent with time. We are being complacent, and that is why the second lockdown has happened in Thimphu. Then secondly, I would it's through experience I'm saying, It's very difficult to deal with the educated lot than the illiterate people, the farmers. In fact, the farmers cooperate with us and listens. The educated lot, they have so many reasons to justify why they are not washing hands. So it's quite, it's an irony here. The second thing, this is the challenge, I would say. Then thirdly, I would say about is the challenge is about is social media, believing easily, fake news. I think, I don't know whether it is the problem of the world or in Bhutan it is happening. We believe easily and fake news. And the second lockdown has happened and so many people are again panicking and there are so many talks going on. So I think these are some of the challenges I could think of as of now. That's it. And thank you for the opportunity.
Lasla, thank you so much. I think we have few more, but I think it's 3:30. We must respect time because it is otherwise, nobody will respect us, right? Time is important aspect. So as a closing remark, I would like to request the three speakers, but 30 seconds, what is the message you want to give through this thematic talk of volunteerism and public health from your perspective? One key point that our participants should take, and 30 seconds each. We'll start from Chimi, Sharaf sir and Sering sir. Lasla, thank you.
Thank you, sir. So the key point I would want to mention is pertaining to the topic public health and volunteerism. I would want everyone to focus on a very holistic model of health, not just physical health, but all aspects of health, be it emotional, intellectual, occupational, environmental health, and public health and volunteerism, they are very much related, because for like without volunteers, there's no way public health can achieve its mission. The volunteers are mandatory for public health. It's like we have, for the, like as I mentioned, for the good of others, we have to do good for our own self, kind of thing. So we must take charge of, or take responsibility, be not complacent, abide by all those COVID protocols, and at the same time volunteer, because it's a very selfless act and it has lots of hidden benefits. Not only does it have economic and social impact at a bigger level. At bigger level, yeah, it has huge economic impact. Say, if you are paying those DSUBs and like voluntary like workers, how much would it amount to the government? And social impact also, because it promotes biodemocracy, because volunteering, it acts like as a bridge, an organic bridge between various socio-economic divides. So it doesn't differentiate between people. So it's a kind of it shows interdependence. So what I mean to say is volunteering really is important, and we have on like personal benefit as well, because it causes mindful transition to us. And so what I mean to say is, let's all focus on holistic health, and let's all volunteer for a change. Let's do something. Let's not be complacent, and together we can do it. So I look forward for unity and communal harmony. That's it.
Thank you, Chimi. Sharaf sir, let's next you. Let's really keep it to 30 seconds. Thank you.
Let's basically, I just want to say, let's not put extra burden on our volunteers and on our health people. Stay home. Just even if you have to go out, let's not give the opportunity for our volunteers in action to tell you to wear masks or wash your hands or to use QR codes. I think by now everybody know that this is the standard operating procedure that we need to follow wherever we go in public places. Let's do that, and let's give a bit of a break to our health staff and to our volunteers, so that they can rest, and so that they can rest easy by knowing that yes, our people will follow without us having to go behind their back. So I think it is a collective responsibility. Thank you, sir. Thank you so much for giving me this opportunity.
Yes, thank you, Sharif sir. Sering sir, you're the last one to go again.
Let me take this last opportunity to thank the organizers for giving me such an opportunity. Though I might not have done justice by being one of the panelists here. The last message I would like to just pass on is let us take individual responsibility. COVID-19 is nothing if you take individual responsibility. And of course, we will not rest until this pandemic is gone. And stay safe and stay calm. Thank you.
Lasla, thank you to all the three speakers for summing up well on your talk. Maybe my last take on the session and my take home message to our audience here is that in medicine they say at times doing nothing is doing everything. So maybe this is the time where our public, our citizens of Bhutan, we should do nothing and stay home. I think that itself will save the nation to greater extent. And thank you to all the three speakers for wonderful and very engaging and very lively discussion, presentation, and of course, a lot of thought-provoking reflections. I think they're all wonderful reflections. Thank you, La. And of course, I end here by thanking the organizers on behalf of the three speakers and myself. La. Thank you, and I hope you all enjoyed the session. And stay home, stay safe. Have a good evening to all. Thank you so much.
Thank you, Dr. Kama. Thank you to the panelists. I'll just maybe just echo what Dr. Karma finished off on is by not doing anything, that's the best way we can contribute during this time. So thank you everybody once again. And for others who would like to join in for the next panel, this is about half an hour from now on local governance. We'll be sharing the link. See you there shortly. Thank you once again, the moderator and the panelists. Thank you so much. And for others connecting with us remotely, thank you.